This podcast is intended for axial spondyloarthritis patients and has been initiated and funded by UCB Pharma Limited. Information contained within this podcast is not intended to be a substitute for consultation with your healthcare professional.
One of the other common questions that are asked in clinic is, what actually causes axial spondyloarthritis?
So the actual cause is unknown, but there is evidence for a genetic link with axial spondyloarthritis. There's a gene called BAM1528, but not every patient diagnosed with axial spondyloarthritis will have the gene, and not all individuals in the general population that have the gene will have axial spondyloarthritis.
And my understanding and what I see in practice is that probably about more than 9 in 10 people with axial SpA will carry this gene, compared with just less than 1 in 10 of the general population of the white Western European will carry this gene. However, as I said, many people with this gene do not develop axial spondyloarthritis. And importantly, some people with axial spondyloarthritis do not have this gene, so it cannot be responsible alone for causing their arthritis. It's probably a series of linked genes that susceptibility to axial spondyloarthritis will end up developing. And what we do know also from recent research that there are other genes, especially 2 other genes called the ERAP1 and the IL23R gene, may also be involved. What's asked a lot in clinic from our patients is, if you have axial SpA, is there an increased risk of my child developing this condition? And we probably estimate this to be around about under 10%. And the question, then the issue is, if you have the HLA-B27 gene, the risk actually probably increases to about 15%. However, there is still a much greater chance that your child will not develop axial spondyloarthritis. Over and above all of this, I think it's important when we talk about causes that if you have other related conditions, and what do I mean by related conditions? These are conditions such as inflammatory bowel disease, so you'd have heard of Crohn's and ulcerative colitis. If you have inflammation of the eye, which is called uveitis, and a skin condition such as psoriasis, may also increase your risk of developing axial spondyloarthritis.